Good morning. If you have cancer that's hard to reach, you want this. Proton therapy. It is shockingly precise, but it's the expert team planning out that therapy that makes all the difference when it comes to this type of treatment. Good morning. It is Monday, April 3rd. I'm Jessica Lovell. Welcome to the Morning Medical Update. So the young woman that you are about to meet, she had to travel hundreds of miles to get her proton therapy. It was such a hassle, she in fact decided to call it off.
I was 19. I thought I was indestructible.
Stylee Gray never expected to hear you have a brain tumor.
You always think this couldn't happen to me until it does.
The early signs started in her eyes.
I was losing my sight. I had double vision and I was going blind.
An MRI meant to rule out any major issues instead confirmed it was in fact a brain tumor, stage 2 ependymoma. She had surgery to remove a large portion of the tumor, but this rare condition also required a specific therapy, proton beam therapy, a type of tissue-sparing radiation treatment that uses pinpointed precision to hit the tumor. This girl from Kansas had to travel far to get it.
Oklahoma City is where I went for the first time, and I actually didn't finish the treatment when I went. It was just out of my comfort zone. It was I was still really sore from having my head cut open.
The pandemic and being away from home took its toll.
I kind of wanted to pretend that nothing was wrong with me.
But then the doors opened at the Proton Center at the University of Kansas Cancer Center. Stylee was ready to try it again.
I think being here, being closer to where I lived, the convenience of that, and having my support system here, that was a very big appeal.
While her vision isn't 100%, she's focusing on good health, eating right, spending time with family, and enjoying what to many may sound like a simple thing. And with that sound, Stylee becomes the 100th patient to complete proton therapy here at the Cancer Center.
It really is just going to be like a symbol of I'm done with this, kind of putting my foot down and saying, I'm moving on.
And we are so glad to have Stylee joining us here remotely this morning. How are you?
Emotional.
Well, we're so glad to have you and to learn more about your story. Again, the 100th patient. It's just nice to have this great milestone and have you here representing that. And we're just so glad you're doing well. Here with me in the studio are two people that represent a much larger group of professionals involved in really coming up with a plan to execute this type of proton therapy and really help a patient through their journey. Dr. David Ackerman is a radiation oncologist at the University of Kansas Cancer Center. How are you?
Great, thank you.
Good to have you. And then we have Janine Turner. She is a medical dosimetrist.
Yep.
That is a new word for me, and I can't wait to learn more about that. We're going to explain exactly how specialized these roles are and learn about more people on your team that really pull off this bigger picture. So, Stylee, I want to start with you. You were diagnosed back in March of 2021. How fast did things move from you learning that you had this tumor to then getting surgery?
So actually, for me, it went the other way around. I had my surgery first, and then they had to kind of dissect the tumor and kind of see what it was until I got my diagnosis. So January, I had my surgery, and then March, I found out what it was. So it's kind of an adventure for a couple months.
So let's talk about, because after the surgery, this was just 2 years ago, the Proton Therapy Center here at the health system at the Cancer Center was not open. So you went to Oklahoma City, is what I understand. You decided to stop doing your proton. Very rare does somebody just stop their treatment. What went into that decision for you?
Just being away from home and from my family and my friends. And I was only 20 at the time, so it just was a huge change in my life that I wasn't ready for. And after not being able to control everything for so long, I was like, I'm taking control and nothing's wrong with me. I'm going home.
I can see that. And then not to mention you're doing this during a pandemic, right? How did that play into your factors?
That was definitely very intimidating to deal with. Just the fear of already, being told you have cancer in the middle of all these other things could happen. And if I got COVID, that would have really affected me in a really heavy way. So it was it was a lot of nerves attached with that.
So you eventually decide to go back. We're going to get to that part of the story here in just a moment. But Dr. Akhavan, in Stylee's case, it was a surgery that got this tumor out. But then why do you do proton therapy on top of the removal? What are you trying to do with that?
Absolutely. Well, it was a high-risk tumor given its size, given it was infiltrating adjacent organs. The patient, Stylee, had a great surgery, but because of these high-risk factors, we wanted to increase the chances of her staying in remission. And so we decided to do proton therapy, and I sent her to Oklahoma City because she really needed it, as proton therapy would have a lot severe, the side effects are a lot less severe, long-term side effects are a lot less severe, short-term side effects are a lot less severe as well.
So she goes to Oklahoma City. You learned that she said, I'm done with it. I just don't feel like doing it. You know, what were your thoughts?
I mean, I respected her opinion given that she's gone through so much at such a young age in terms of the stress of being far away from home. I was a little, but you know, in the back of my mind is I think she really needs this radiation treatment. So I was really happy that we got our doors open and got her treated.
And got her
here.
back. But it really goes to show that story that we've been telling of the inconvenience and how difficult it is for a patient to get their therapy far from home, right?
Yeah, it was very frustrating to send her so far away. Yeah.
Well, we're glad she came back. Cancer care at the health system and at the cancer center it's a big, ginormous team effort. There's oncologists like Dr. Akhavan. You've got dosimetrists like Janine, and then you've got a medical physicist, nurse navigators, you name it. And Janine, just what other roles might I be leaving out?
Right, so we also have an incredible team of radiation therapists. They're the ones who actually deliver the treatment to the patient every day and see the patient every day. They meticulously make sure they're in the perfect position on the table, and we're very grateful for our excellent radiation therapy team. We also have anesthesia in the department, and for people who our youngest people who can't lay still need that.
Our pediatric patients.
Right.
So it's yeah. I would say you're in good hands. You're in a lot of good hands when you come and get proton therapy. So Janine, what is a medical dosimetrist? What is your role?
Right. So we're responsible for creating or designing the actual treatment plan. So that involves deciding the beam angles, how many beams there are going to be, what is the energy, the amount of time the beam is going to be on. The physician will write a prescription for radiation just like any other treatment or medicine, and we follow that prescription to make sure we deliver the desired dose to the tumor while minimizing the dose to the critical structures as much as possible. So that's what.
So you come up with this plan and then present it to the physicians?
Yes, we review it with the physician and the physicist, make sure we're all on board that that is the best plan for the patient.
So we're talking about proton therapy, but there's also photon therapy. What's the difference?
Right. Well, photons are delivered in a solid beam, like when you turn on a light, you have a solid beam, and we can shape that beam into different shapes. Protons is delivered with a tiny, thin beam, smaller than a pencil, and it deposits in spots and doesn't go all the way through. So each spot will stop dose where you put it, so there's no exit dose.
So I want to talk more about the process that in the moment of getting this proton therapy. And Stiley, we have some video of you getting one of your last sessions here. So you're laying down on the table. They put a sheet over you. You said it's quite chilly in the room. Is that what you said, Stiley?
Yeah, it gets pretty cold in there.
And then they place this mask over your face. What was that like for you?
When I first started doing it, it caused a lot of anxiety just because it wasn't natural. It's, your head is kind of down on this table. But I also understood why it was necessary. So keeping that in mind kind of helped me calm myself down a little bit.
Because you're not in there a long time. How long are these sessions lasting for you?
I don't know the exact time. I could listen to 3 or 4 songs, so that kind of time. It didn't ever feel very long though.
Long. You can bust through 3 songs in no time. So,
Yeah.
Dr. Akhavan, why is that mask so important? We've heard people who've gone through Proton. That's kind of sometimes the worst part of it. It's not the therapy. You can't feel it. Sometimes it's just that discomfort of the mask.
So the mask is very important to immobilize the patient. We're dealing with treating patients with very critical structures adjacent, such as the brainstem, auditory structures. So the mask needs to be quite tight in order to prevent the patient from moving their head, so we know when we deliver the beam that we're safely targeting the tumor or the tumor cavity and avoiding the adjacent structures.
And what happens to those masks sometimes when people are done with them? They take it as a souvenir?
Yeah, sometimes they turn it into art forms, they turn it into paper mache, and I've seen very elaborate masks that turn into beautiful artwork that you'd like to have on a wall sometimes.
Yeah, and to say never to put on my face again. Better on the
Exactly.
wall than on your face.
That's
So Dr. Akhavan, let's talk. A lot of children go through proton therapy. It causes fewer side effects as they get older. How do you keep them from moving around? And Janine, you had mentioned a little bit about that, but how does that all work when we're talking about small kids? Are there other parents allowed in? Is there any way to keep them calmer and less anxiety for
Yeah, we
that?
do rely on our partners in pediatric anesthesia, as Janine mentioned, which is very important to sometimes put them completely at sleep or calm them down is very important. Parents cannot be in the vault once the radiation beam is on, but there is cameras that we could talk to them if they're going to be partially awake to listen to them.
And remind folks why Proton is so great for young children
Absolutely.
in their little bodies and organs.
Yes, absolutely. When you have a child that has a lot more neurocognitive development, a lot of more neuroendocrine functions are very important, such as preserving long-term fertility. Fertility and hormone function all is controlled in the brain initially. So it's very important to avoid injury to those structures. And proton therapy, as Janine mentioned, when you deliver it, it stops at a certain location. We know where it stops, whereas photons continues on its journey, exiting the normal tissue. So it's very important to keep these normal structures at a very low level of radiation so we can preserve important things like fertility, neurocognitive function to maintain development of the brain.
And technically, Stylee's not too far out from that pediatric age group. She's only a few years out of that. So would she fall under that category of that tissue sparing, especially when we talk about fertility?
Yes, absolutely. It's very critical. That's why I made the decision to send her far away to Oklahoma and because we needed that additional safety of protons.
And how do you make sure that the photon beam is accurate? How do we make sure that that is accurate?
The proton beam?
Yes.
Our physicists do a lot of quality assurance before a patient is ever treated. That plan is actually treated on a piece of equipment with a lot of measuring devices in it to make sure that the dose we're delivering is exactly the dose we want to deliver.
And that's the job of the medical physicist.
Yes, yes.
I have to keep all these really important jobs
Yes.
straight. So, Stylee, you told us before the program that you want to help others learn more about their rare cancer. You're actually making a career choice based on this experience. Tell us more about that.
Yeah, so going into it when I was first learning about my diagnosis, excuse me, there wasn't a lot of data on it because it is rare. There's not a lot of people that had it. So getting to be part of making more data to help more people if they have it, which hopefully that's not the case, but getting to be part of learning and helping other people understand what they're going through means a lot to me. And as far as my career choice, I have always been interested by the medical field, but now being a patient in such a big way, it has really encouraged me to help people in the way that I've been helped and kind of put me in a position where if needed, I could relate to them and make that process easier for them as well.
Yeah, we had talked earlier about how reassuring that's going to be when you meet a patient. You could say, I used to be you. I mean, what a ray of hope that must be. Talk to me about that.
Definitely. I think that especially in young people, kind of thinking with my mindset at 20, I don't want to do this, I'm invincible, but kind of being able to say, hey, I did this when I was your age, or I did this at this age. I know what you're feeling. I know all of those emotions, but it's going to be okay. And I promise this is going to help.
How are you feeling today? How do you feel? Any effects after the proton therapy?
I honestly now feel pretty up to par, pretty close to back to normal. I think the biggest side effect I had was just for a couple weeks after, just kind of getting tired, but currently I'm doing perfect.
And that's good. Is there anything that you're looking forward to getting back to, or that you're already back to doing that maybe you had to pump the brakes on?
I think the biggest thing is playing with my dogs and my horses, being able to be outside and have the energy to hang out with them and hang out with friends.
Yeah, you take those things for granted, just being outside, the sunshine, the animals, they're good for the soul, right?
Mm-hmm. And this nice weather we've been having is extra helping.
Sure is. It sure is. So, Janine, we listen and we hear these stories. This young woman sharing her journey. What's the most rewarding part of this job for you?
I would say the most rewarding part for me is just being a part of this team that just really works together to make the best plan for the patient so they can have the least amount of side effects and have good quality of life.
Dr. Akhavan, same question.
Absolutely. I think when I know I can help a patient and I see them and I can reassure them, whether it's to help any pain or suffering, or potentially when I open up an MRI scan and I tell them the great news, the tumor's under control, or it's in remission, it's really quite rewarding. I'm very honored to be in this position.
And was Stylee a good patient for you?
It's just fabulous. She went in without any side effects at all. It was quite remarkable.
How was it ringing that bell? I mean, I have to ask, but I think I know the answer.
It was so liberating, I think. That's a for it. I just didn't want to stop ringing it. It felt so good. It was a very big staple in my progress of healing.
Good. Never forget how that felt. That's all you. That's all you. Be sure to ask your questions. You can use our chat on YouTube or Facebook. You can tweet us or you can email us at the Medical News Network. That info is right there on your screen. Let's get to our COVID count. Dr. Dana Hawkinson joins us, Medical Director of Infection Prevention and Control. Good morning. How are you?
Hi, I'm good.
Hey.
Should be a nice Monday.
Yes.
I think as far as acute cases go, it seems a lot better than it was at the end of last week. So we have 34 total cases, 24 active, but unfortunately 4 in the ICU and 3 on the ventilator. So, a high propensity, a high proportion of severe disease here right now, unfortunately.
All right, question for you. Healthy young adults might not need yearly COVID boosters. That's according to the World Health Organization. The WHO plans the future for vaccination, recommends that 1 round of boosters for everyone. But after that, only high-risk adults are advised to get that extra dose of boosters. So what are your thoughts? What's this telling us about the effectiveness of the vaccine?
Yeah, I think this is good. Again, remember, this is for the booster, not the vaccine. So we still need primary series and an initial booster. Really what we have seen clinically with it's really that 3 exposures to spike, whether that's vaccine-induced exposures to spike or infection. It's really those 3 exposures to spike that really build that immune system. So I think that for young people right now, the data would support that. Even here in the United States, the clinical data that we have so far from the bivalent boosters, number one, again, we've talked about this, they show that they're safe, but they show that for the most at-risk populations, i.e. those people with higher age or comorbid conditions, the bivalent boosters absolutely do provide a benefit to reduce the risk of hospitalization and severe disease. That benefit is certainly diminished when you have those younger populations, which, again, were not affected to the extent that older populations were. So I think, this is World Health Organization. We'll certainly see what APIC, our council that has the vaccine recommendations recommends, as well as the CDC, for boosters moving forward. But I think this is a good step. This would certainly be supported clinically as well.
Let's check for any reporters on the line today. Let's get to our community question, shall we? Ruth Ellen wants to know, is proton therapy used for patients with glioblastoma brain tumors?
It is currently being studied in clinical trials in patients where we want to go to a higher dose, comparing proton versus photon therapy, but it is not the standard of care right now.
So we know that it's used a lot for prostate patients and tumors like what Stylee had. Can you go over some of the areas in which proton is also helpful for?
Yes, and different indications for pediatric patients. Different types of pediatric brain tumors are very important. It's currently in clinical trials in other cancers as well to minimize the long-term side effects.
What kind of follow-up is Stylee going to have with you? What will this look like for the long term?
It'll be MRIs of the brain and spinal cord every 3 to 6 months going for the next couple of years. And after 5 years, it'll be less frequent than that.
Jenny wants to know, she's asking Stylee, she's had a friend who's gone through something similar and just wants to know what you've learned from this experience.
I have learned to kind of lean on the people around me and really allow them to be supportive, and definitely have learned to listen to my doctors, because as much as I think I know at a young age, I don't know everything, surprisingly.
Oh, come on. I know. It's tough when you figure that out, right? When you figure out you just don't know everything. Macy wants to know what happens if you're just a little bit inaccurate with the proton beam, or is there no such thing?
Well, we have our quality assurance, like as Janine said, our medical physicists, and we look at what the worst case scenario is. If a patient moves their head in that tight mass in the same direction every single time, and what is that worst case scenario? And we have that baked into our radiation plan, so we're ready for different contingencies to make sure it's a safe plan and how we treat it every day.
And Aaron wants to know, how long is the longest session that someone would have to be in there? Is it just patient by patient basis?
Depending on what the tumor is, typically for brain tumors, it's about 5 days a week for about 5 to 6 weeks treatment.
So Eric wants to know, if Proton is precise and so precise, why do you need to keep everyone out of the room during the therapy? Explain what the dangers there and what you're trying to avoid.
That's a great question. Safety is very important. From X-ray radiation, there is that lower dose that's in the room when the beam is on. For proton therapy, we want to follow the same safety precautions. Just because the dose is low doesn't mean we should, throw a party inside there when someone's being treated.
Okay, good to know. Are there any other cases where a patient might just need proton? They don't need the chemo. They don't need the surgery. Would Proton just do the job?
Absolutely. There's some tumors like liver cancers, for example, where it's just the isolated tumor right there, and surgery. Patient's not a candidate for surgery, and chemo is unnecessary. And then a Proton can give a very high dose just where we want it. In which case, we deliver just proton therapy.
And Dr. Akavan, what have you learned since the Proton Center has opened? It's just been a couple of years. What have you learned? What's been the most exciting part, and what are we looking forward to?
We're looking forward, first off, more indications for the proton therapy here, as we're developing more immobilization type devices. For example, we're looking to open it up for, as I mentioned, for liver cancers. There's a little more motion when you're treating someone where the liver is moving around. So as we get these immobilization devices, we can start treating those patients, and avoid, surgery or chemotherapy just with radiation. And it is definitely exciting to have patients and not have to send them far away out of state. So I'm very excited to give patients options that are local.
Janine, same question. What excites you about the future of Proton from your position as a dosimetrist?
Yeah, that it's a growing field. There's a lot probably coming down the pike, even years from now, that we'll be able to do with protons that we don't know yet. A lot of research being done with protons in different areas. So yeah,
it's an exciting time.
It's a very growing thing.
It's growing, and it's just great to see these patients, isn't it? What's
Absolutely.
it like for you just to see Stylee here today, not in the clinic?
Yeah, it's fabulous that she's doing so well, and she did so well through the treatment. So I'm really happy that she's getting back to her normal routine with her horses and just having a great time.
What was it like to spend time, Stylee, with Dr. Akavan and just kind of create that bond with him?
I think it was really nice it made things go a lot easier, and being able to joke around and kind of have that relationship made going through treatment a lot easier. And I kind of looked forward to seeing him on Thursdays for kind of that banter and just to hear things are going well.
Well, you'll just have to keep coming back on this program. We'll keep reuniting you, and you'll just keep telling him things are going well from home. So that's good. And when I told him that you were joining us on the show, he jumped at the chance to be here. So that says a lot about your connection. Let's get today's takeaway. And Stylee, what do you want people to know about your story and about Proton?
I just want people to know that it's really important to always keep learning and just keep pushing, because even when you think it's impossible and things are never going to get better, they always end up getting better. And the more that you push, the more that you try and fight and just listen to the people around you, the better you feel at the end.
Yeah, you're back on the horse, as they say, and good luck with all of that and your career moves. And we just can't wait to follow you up on where are they now. So, Stylee, thank you so much for sharing today. Dr. Akhavan, just what's today's takeaway from where you stand?
In general, I'm very excited to have proton therapy for patients at the University of Kansas Health System. It's important to know that proton therapy is not just physicians and dosimetrists, but medical physicists, and it's really a team approach for us to deliver this amazing technology.
It sure is. Janine, you've been a great part of this team. What do you want today's takeaway to be?
I agree with Dr. Akhavan. That's a great statement. Yeah, we have an excellent team here, and it's just great to be a part of it.
Do you get to have interaction with the patients as they come and go?
We're mostly behind the scenes, but sometimes we do. Yeah, sometimes we go downstairs and assist. When they're getting their first CT sim.
And do you ever get to be there at the bell ringing?
No, but I hear it.
I love that.
I hear it.
That's good. We said, you ring it loud, ring it proud. I always say we never get tired of hearing that bell ring around here, do we, Dr. Akhavan?
Yeah, it was great. I was there when she was ringing her bell, and it was very... it
was intense.
Yeah, it was very uplifting for me, too. She really did give a couple really hard
I didn't think she was going to stop there for a second, so that was really great. You did it so loud that Janine could hear it, so that is good. Dr. Hawkinson, final thoughts from you?
Keep ringing that bell. A good story today about vaccines. We know that the influenza vaccine compilation for 2022-2024 influenza season was named in February. That is in production. We know recommendations will come down soon for that. We will also be waiting for the recommendations from the CDC for the COVID boosters as well. I think this WHO World Health Organization headline today was good, but we'll see what our CDC has to say. And those recommendations should be coming out here in the next few weeks.
Yeah, people would be waiting for that because they've been asking that question about those boosters.
Absolutely.
They want to stay up on top of it. So, Doc Hawk, thank you for that. And thanks to all of our guests and our viewers for being with us today. Get out there, make it a great Monday. We'll see you back here tomorrow. A leader, a mentor, and a nationally acclaimed expert. The Midwest's best cancer center has a new doctor in charge. I'm Jessica Lovell. On the next Morning Medical Update, we meet the man who's still treating patients and leading fellow doctors in cutting-edge cancer research. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.